Good morning, everyone. Thank you for joining Forensic Analytical Consulting Services today for our webinar, Legionella Beyond the Cooling Tower. Today's webinar will be hosted by Forensic Analytical's very own David Kahn and Madeleine Rebullida. David is a certified industrial hygienist and project manager out of our San Francisco area office, but later this month will be joining our office in the Pacific Northwest region. David is a leader in FACS's Northern California Industrial Hygiene Group and in FACS's Water Quality Practice Group, having led multiple preventative water management assessments and developed numerous waterborne pathogen management plans. Madeleine is also a project manager for FACS out of our Bay Area office and is a leader in the FACS Mold and Moisture team, as well as the FACS Northern California Water Quality Practice Group. Madeleine has responded to multiple Legionella disease outbreaks, performed numerous waterborne pathogen risk assessments, and is partnering with a variety of clients to train their staff and implement site-specific water management plans. And with that, I'll now pass the presentation over to David.
Hello, everybody, and welcome to our presentation. Couple of details on the mechanics of the presentation before we get started. Our audience, if you haven't noticed, you have started in listen-only mode. This is to reduce background noise while the presentation is going on. This is not so that you cannot communicate with us. We do intend for you to be able to ask questions, and we will do our best to respond to them. If you would like to ask a question during the presentation, please go to the text box in your control panel, select Send Questions to Staff, type in your question and send it our way. We will respond to questions at the end of the presentation, and if we run out of time, we will respond to questions by email after the presentation is over. And please do send in questions. We are eager to hear them. All right, just to get started, we'll talk a little bit for those of you who maybe aren't as familiar with FACS about what we do and who we are. We are environmental health and industrial hygiene consultants. We have expertise in healthcare, environmental health and safety, hazardous building materials, mold and moisture, water management, of course, indoor environmental quality, exposure assessment and control, wildfire smoke assessments, and architectural and engineering support. We provide services, all sorts of environmental consulting services for a whole variety of physical, chemical, and biological hazards. We provide our firm incident response management program for property owners and managers. We support and perform water management plan development and water quality management programs. We have litigation support services, risk communication, employee training. We have a FACS-Track cloud-based records program, and we provide fit testing and other environmental compliance services for our clients. All right. That said, I'm going to hand it over to Madeleine to get started with the presentation.
Good morning. So this is today's agenda. We're going to cover the background and history of Legionella, outbreaks in the United States, some regulations and references that are relevant to Legionella, the ecology and microbiology and amplification risks of the Legionella bacteria. We are going to talk about cooling towers and the engineering of some other building water systems and how they relate to Legionella. David's going to cover the some updates on the state of the industry, some current events, and then we're going to talk about practical implementation, about how you can employ a water management plan in your own facility. So first, let's talk about the background and history of Legionella. The first known outbreak was in 1976 at the Bellevue Stratford Hotel in Philadelphia. There was an American Legion convention there, and over 4,000 people attended, and they had 221 confirmed cases of pneumonia, and among those, 34 people died. So the CDC did an investigation. After months, they still had no results. They looked into whether it was a chemical agent, refrigerant release, toxic fumes, and the consensus was that it was not a bacteria. And the gentleman you see in this picture is Dr. Joseph McDade, and he was able to isolate some bacteria in the cooling tower samples. With that information, they were able to look back and see that there were some other outbreaks prior to the 1976 one at the Bellevue Stratford. In fact, in 1974, there was another outbreak of pneumonia at the Bellevue Stratford, in 65 at another hotel. in Washington, D.C., and in 1957. So this is some information from the Center for Disease Control. Just the number of people with Legionnaires' disease has grown by nearly 4 times from 2000 to 2014. We do have some updated information on that later in the presentation. Legionnaires' disease is obviously named after the American Legion Convention there, but it is deadly for about 10% of the people who do acquire it in the community. So because we had an outbreak, we need to create some regulations and references to try and manage some of the risks to control the spread of those outbreaks. So this is ASHRAE 188, 2018 version. It did establish the minimum risk management requirements for building water systems. It covers commercial, institutional, industrial, multi-unit, residential, quite a lot of details. We will go into this a little bit deeper. This is the American Industrial Hygiene Association guidance on the regulation, evaluation, and control of Legionella in building water systems. So this is also a reference document that we use when we're looking at creating a management plan. So ASHRAE 188, how do you know if your building applies to ASHRAE 188? There are some specific questions they ask in there, and we have a checklist later on in the presentation that we'll go through in detail. But specifically, it looks at plumbing systems and risk factors being relevant to the type and use of the buildings. All right, this is the fun part for me, the ecology and microbiology of Legionella. There's some really beautiful pictures of the Legionella bacteria there. So the Legionella species, I won't go into too much detail because I don't know, maybe not everyone's as excited about science as I am, but it is a gram-negative rod. There's about 50 different species of the Legionella bacteria, and among those species, over 70 different serogroups. And we'll talk about serogroups in the next slide. It is naturally occurring, occurs in water, on the surface, in the ground, in the soil, and is very commonly found in water systems at low concentrations. So the risk of Legionella is not that it's there, but that it can amplify the spread. So you can find it in water, potable water, industrial water, lakes, etc. Areas of plumbing systems that have a low flow are at risk, and we'll talk more about that in the amplification section. Temperature plays a big factor. So generally temperature ranges between 68 to 120 degrees Fahrenheit are going to put you in a growth condition. It is a commensal organism. So what that means, if you look at the lower left-hand corner of the slide here, you'll see a really cool picture of an amoeba grabbing a Legionella bacteria. So they work with each other. The amoeba creates this nice little safe, cozy space for the Legionella bacteria, and they're able to reproduce, replicate inside that amoeba. Legionella-associated illnesses. So the risk of Legionella is primarily from being exposed to mists and aerosols. So you can inhale the bacteria from these mists. Legionnaires' disease is the one we talked about earlier. This is a type of pneumonia. Pontiac fever is another type of Legionella-associated illness. There is an incubation period for the bacteria, for the illness. So with Legionnaires' disease, you're going to start seeing symptoms within 2 to 14 days after exposure. Pontiac fever a little earlier, 1 to 2 days. And about 1 to 2% of all pneumonia cases are associated with the Legionella bacteria. So if you recall, we talked about all the different species of Legionella bacteria. Legionella pneumophila is responsible for about 90% of the human infections. And among those, the Legionella pneumophila, there's about 15 different serogroups. Serogroup 1 is the one most prevalent. It's the most prevalent variant with Legionella-associated illnesses. So a serogroup or a serotype is a distinct variation within a species of bacteria or virus, or among immune cells of different individuals. So these microorganisms, they're classified together based on the characterizations of the surface of their cell, and that's how we're able to create an epidemiologic classification of organisms at the subspecies level. I know that probably sounds like a lot of science, but basically serotyping plays an essential role in determining the species and subspecies of the bacteria, which is helpful if you're trying to diagnose Legionella-associated illness. So people who are most at risk are the elderly, people who are immune compromised, and as you saw from our history, that these can occur in hotels, hospitals that have mists and aerosols, or they have at-risk populations, long-term care facilities, spas, where temperature plays a factor, are also risk factors for Legionella-associated illness. So, as I said earlier, we're going to talk about amplification risks. So we know that Legionella is commonly found in water. We know it's going to be there. The issue is that if it's able to replicate or amplify. Once it amplifies, it can be transmitted, there's an exposure, and then an infection. So amplification conditions, if you recall, we were talking about temperature, range between 68 to 120 degrees Fahrenheit, or if you have a water system that has an unstable or fluctuating temperature, or if there is inadequate or no disinfectant in your water system. And it's going to talk a little bit more about municipal water supply and how that factors into things later on. If you have dead legs, so a lack of flow, stagnant water, or a buildup of scale or sediment, biofilm, changes in water pressure and water chemistry can also create amplification conditions. And areas where you're trying to conserve water, so you have some low use areas, those can also create stagnation where you'll have amplification. This is a really nice graphic that we created that shows the growth ranges for Legionella. So you can see between 90 to 180, that's an ideal range of growth for the Legionella bacteria, and it sort of spreads from there. So there's a little bit of gray area in here about interpreting temperature results. So that's why it's important to have a consultant come in and help you understand all the factors and give you a little bit more context for the temperatures in your waters. So biofilm, and we mentioned earlier in a couple of slides, biofilm can form on surfaces where there is a hospitable substrate. If there is some sediment or scale, it's a place where the bacteria can attach. And once they attach, they form a happy little group together, and they start sending messages to each other that to create this substance called from predators or threats, and they are able to amplify within that biofilm. And as you can see in that number 3, they detach and then they can spread throughout the water system. All right, so I'm going to hand it over to David so we can talk to you about engineering.
All right, so we're going to start by talking about cooling towers. Cooling towers are often identified as the source of outbreaks, and they definitely are a point of risk. And so we want to make sure we go over what cooling towers are and what the risks associated with them are. And then we're going to go into talking about all the other water systems that also are potential areas of risk for growth of Legionella and risk of infection. And then so cooling towers, as many of you probably know, there's systems for transferring heat from a building or from a process into the atmosphere. They use evaporation of water to transfer that heat into the atmosphere. And as a result of the way cooling towers and evaporative condensers are designed, they will typically generate a large volume of aerosol or mist, as well as water vapor that is then dispersed into the atmosphere and can be carried quite a long distance by the wind. Also, because they are rejecting heat, the water that is circulating in the cooling tower is going to be warm and typically within the growth range for Legionella and for other waterborne pathogens. So treatment and management of cooling towers and evaporative condensers is an important component of any water management plan because there is a genuine risk there. Going into it a little more, here's, you can see here we have a process of some sort. It could be a building air conditioning system. It could be an industrial process or other system needing to, that needs heat removed. And so that system will, cooling tower water will collect heat from that system. The water will be transferred by a pump into the cooling tower, where it is sprayed through the tower, and air is drawn over that water spray, typically by fans. And as that air is drawn over the water spray, evaporation cools the water. However, there will also be aerosols and droplets drawn out of that water and carried by the fans into the atmosphere, which creates what's called drift. And that drift can contain, those aerosols can contain live infectious bacteria, and which can be carried by the wind for quite a long distance. There have actually been recorded instances of infections tied to contaminated cooling towers where the point of exposure was a mile or more away from the cooling tower itself. Once the water passes through the cooling tower, it's collected in a sump where you have typically both, the water will concentrate minerals and salts. It will also collect sediment from the atmosphere, and it is, again, at a warm temperature that is in that bacterial growth range and can create a very, very hospitable environment for biofilm and waterborne pathogen growth. So that's why there's a significant risk associated with cooling towers. I also like to mention when I talk about cooling towers, because I've gotten this question quite a few times, cooling towers typically are not directly connected to a building air conditioning or HVAC system. There's typically a chiller unit that transfers heat from the interior chilled water lines that serve your HVAC system into the condenser or condensate water that is circulated through the cooling tower. And so a well-maintained air conditioning system is typically not going to be a risk for waterborne pathogens, because the water in that system should be sealed within the system and should not be leaking out or something that occupants of your building are exposed to. Poorly maintained systems obviously can be a different story, and there can be issues with leaks, with condensate water building up in the system and other issues, but they can put you at risk for various water-related building problems. Typically, however, not a Legionella risk. Next, we're going to talk about other water systems, and this is, again, something that a lot of you will be familiar with parts of these systems, but we want to make sure we go over it because there are a lot of different places that can potentially harbor bacteria and, under the wrong conditions, support amplification of Legionella or other waterborne pathogens. First, and generally, you are going to have your potable water systems. These can be very simple. Think of your typical home. Water comes in from the city, is distributed through a few pipes to a few sinks and showers, and that's pretty much the whole thing. Or in larger buildings or facilities, can be quite complex with all sorts of pumps, filters, pressure regulators, and other water management systems. Hot water especially is typically managed through a series of appliances to control the temperature and quality of the water, and is often in a continuously recirculating loop to deliver temperature on demand at all points of use throughout a larger building. Most facilities get their water from a municipal water supplier, and so that municipal water supply is going to be treated by their supplier. However, it's important to understand that Legionella, as Madeleine already mentioned, is a naturally occurring bacteria. It's likely to be present in most sources of water that are used either by the municipal supplier to make potable water for distribution, or by any well or other system that you might be using on your own site if you are not supplied by a municipal supplier. Now, municipal water will be processed and treated to remove bacterial contamination. Typically, they also add an oxidant, a disinfectant, usually chlorine or monochloramine, and this water will be then transmitted through their distribution pipelines to your site. However, depending on the quality of your supplier, depending on the layout of their system, you may or may not receive water that has an effective concentration of disinfectants in it. It's very common for, incoming water supplies to have low residual disinfectant by the time the water is actually delivered at your site, and so that can be that incoming water quality can be a point of risk. Additionally, there are likely to be low levels of Legionella and other waterborne pathogens that are coming in with that municipal water. These are naturally occurring bacteria, and the municipal processing will not remove 100% of it from that water. And that's important because the low levels of pathogens are pretty universally present, and so if there are hospitable conditions for growth in your internal building water systems, then those low levels of pathogens can colonize your system, amplify, and create a substantial risk to you and your building occupants. And the other really critical factor to note is that water is owned by the municipal supplier until it reaches the point of connection to your building, usually a backflow preventer. Past that backflow preventer or other point of connection, that water is the responsibility of the building owner or operator, and it's going to be your responsibility to ensure you're delivering a acceptable quality water to your building occupants. Talk a bit about some of the other systems. You all have domestic hot water systems in your buildings. Often in larger buildings, this water is softened to reduce maintenance and prolong the life of your hot water systems. It's very often recirculated throughout the larger buildings to support delivery of a good temperature. If you recall the slide Madeleine showed a few minutes ago with the growth ranges for Legionella, ideally you would want to deliver your hot water above 120 degrees Fahrenheit, because that above 120 degrees is not favorable for bacterial growth. And even better would be to heat and circulate water above 140 degrees, because that is a temperature that will start to actually kill off Legionella and other waterborne pathogens. However, I think this perfectly encapsulates one of the big challenges with water quality management in general, which is that you usually have a number of competing concerns that you have to balance against each other, as many of you are probably saying to yourselves right now, hey, we also have to worry about scalding our users. We typically can't deliver water at the point of use hotter than about 120 degrees Fahrenheit, because then we are at risk of injuring our users and occupants. And so you end up in this situation where you have to balance the risks against each other and come up with a solution that best fits your particular system and allows you to manage your risks in the most practical way. And so that is kind of the overall challenge of the whole, that you're dealing with a variety of competing factors like that you have to balance. Talking about cold water systems, incoming cold water supplies, again, typically from a municipal supplier. If you're on a well or other natural supply, you'll typically already have a treatment system in place to manage risks of waterborne pathogens. Common treatment systems include, ultraviolet, oxidants such as chlorine. There's proprietary treatment systems, filtration, copper, silver ion systems. But typically, most facilities aren't treating their own water. You are relying on whatever disinfectant is provided by your municipal supplier. Ideally, you'd want this water to be delivered at less than 77 degrees, and then for distribution throughout your building, maintained at less than 77 degrees, again, to keep it out of that favorable temperature range for bacterial growth. This can sometimes be a challenge, because I've definitely seen systems, especially in the summertime, where the reservoirs and water supplies start to heat up. Your municipal supplier delivers your water at 75 degrees or even 80 degrees. And so you're kind of coming in already at a disadvantage. This is just sort of an example of a schematic or conceptual sketch of a building water system. Wanted to show this here because this is a very important piece of managing your building water systems, is understanding how they're laid out, how the water moves through the system, and how it gets to the various points of use. And I want to highlight that while it's certainly possible to get as in-depth and in detail as you'd like to go, this isn't necessarily something where you need to be starting out with engineers and CAD drawings and super sophisticated engineering of the system, so much as making sure you have a good baseline understanding, a good conceptual understanding of your own building system, so that you can start to manage it and implement controls that are both reasonable and effective for your particular system. And the first step is always to understand what you have. Other processes that can be potentially at risk is what we call industrial water. These are both direct industrial processes, such as, if you're operating a factory, you have a bunch of machine tools with water cooling, but these can also be all sorts of other water uses just for non-potable use, right? Your boilers for heating, your humidifiers, your fire sprinklers, emergency equipment, industrial chillers, all sorts of things like that. The important thing here is just to make sure that you don't have what are called cross connections. You don't want water that is used for industrial purposes being able to get into your potable water. And then if you have places where your occupants may be exposed to that industrial water, you're going to want to make sure that whatever exposure they have is managed to minimize risk. Recreational water sources, pools, hot tubs, gyms, locker rooms, decorative water fountains, ice machines, misters, irrigation sprinklers that, can be something that, kids might play in or something like that. All sorts of sources like this. Spas, hot tubs, things like that tend to be very high risk. They create a lot of aerosols, and they're typically maintained in a very favorable temperature range for bacterial growth. But anything that can generate an aerosol can be a potential point of risk if it is not well maintained and controlled. So I'm going to talk a bit about the state of the industry and update on a couple of current events and more up-to-date data that is going on. First, we want to talk a bit about Legionella regulations in New York. New York City and New York State are the first governmental agencies to pass actual regulations governing risks of Legionella. They passed them in response to several large outbreaks in 2015. And these regulations have only been in place for a couple of years. The regulations are primarily focused on managing cooling towers, that they had identified cooling towers as their primary risks, and they did not require assessment of any other risks or management of any other building water systems. Based on the first couple of years of data from implementation of these New York regulations, Legionella cases have continued to increase in New York City and New York State. There have continued to be large-scale outbreaks of Legionellosis. And our thought is that this is likely because these regulations only focused on cooling towers and did not include management of all building water systems and potential sources of exposure to Legionella. Kind of going over some recent data in a little more detail. These next couple of slides are going to go over the incident rate of Legionellosis in the United States. This is in 2007. Oh, sorry, and I should mention New York State regulations also do have additional specific regulations for healthcare, hospitals, and other similar facilities. This data is from the CDC. As you can see, in 2007, we're seeing only in a few states do we see more than one case per 100,000 people reported. The numbers increase steadily from 2012 and 2017. One thing to note about all of the increases that we're seeing, a big component of this is likely to be that there is increased testing and diagnosis, that the tests for Legionella, other than for Legionella pneumophilus group 1, take a substantial amount of time to complete. And so in a medical scenario where your goal is simply to ensure the health of the patient, it is very typical to treat first and then maybe not, if the patient recovers, maybe not even do thorough diagnosis for Legionellosis. However, as more and more diagnostic testing has been performed, that's going to increase the reported cases of Legionellosis, where before it might have simply been a non-specific pneumonia diagnosis. Nonetheless, it is likely that, as well as increased testing, there are increasing cases of legionellosis. So in summary, looking at the kind of current data and the implementation of the New York regulations, the regulations to date have not been effective in slowing the increase in legionellosis cases. The diagnoses and complaints are increasing across the country, and based on the data so far, it looks like it is necessary to manage all building water systems' potential points of exposure to manage risk and liability. It's not sufficient to simply focus on just one building system or component. All right, now we're going to start talking about some of the kind of practical concerns and implementation steps that you can take to manage your building water quality.
So this is probably one of the big issues that you're facing is, or concerns that you have, are some potential financial ramifications. So if you do have a Legionella outbreak or an exposure at your facility, there's more than likely going to be some legal exposure, which is expensive. It can involve compensation for lengthy hospital stays. A typical hospital stay for a Legionella-related illnesses is going to run about 6 figures in medical bills. Also, more importantly, is that acquiring a Legionella-associated illness, though that we're looking at a higher survival rate, it's not terminal, it's not always fatal, there are irreparable medical injuries and effects. And many people who have been exposed to these illnesses report experiencing symptoms long after, for years after diagnosis. So you're looking at settlement claims ranging from, hundreds of thousands of dollars, over $5 million. So ASHRAE 188, that's the regulation that we talked about earlier that has that facility checklist. It may establish a duty of care for use in litigation. That's a question mark there because it depends, it can be interpreted in different ways. So looking at some of those liability considerations, it's difficult to link cases all the time. So 2 or more cases can be epidemiologically linked, but there's often no real smoking gun. There are multiple potential sources. As you've seen in this presentation, there's a lot of different avenues of transmission from mists and aerosols in different building water systems.
It can be very difficult to prove that a patient and environmental sample match, or that if samples are collected, if the patient is, that samples are collected from both the patient and the environment where they were exposed. What's important to understand, though, is that having an implemented water management plan that takes into consideration ASHRAE 188 and the other most current guidelines and standards, published standards, will help prevent claims of negligence in court. Some of the common myths that you can encounter when you're or may have heard relating to Legionella, you can hear that sampling is required or sampling is not necessary. We would say that sampling is necessary if you want to accurately characterize your risks and your building water system, but it should only be done in the context of a carefully considered and established water management plan where you're testing specific hypotheses and concerns related to your building. Sampling without a plan in place will give you data that is very difficult to manage and interpret. Treatment vendors will often say they can provide a turnkey service. This typically is going to be a question of they may or may not have expertise in managing all building systems. They may be presenting you with a solution to a problem you may or may not have, and they may only be treating part of your building water systems, not looking at the whole picture. There's also something of a question of conflict of interest. Of course, they certainly have an interest in selling you a treatment system, and that may or may not be the right solution for your particular situation.
So we talked about the use of water treatment from the municipality. So you're thinking about treating the water in your cooling tower as a way to solve or prevent Legionella risk. And really the mechanics, the engineering, and the state of your building water systems play a huge role in whether or not Legionella amplify in different parts of your system, regardless of the amount of disinfectant used. So that's not a one way to solve everything.
It can also be expensive and can cause additional wear and damage to your water distribution systems, leading to corrosion and leaks. It can also, you also have to manage the risk of disinfectant byproducts, which are regulated by the EPA and will typically require permitting for installation of a building water treatment system for most of the common types. The last thing you might have heard is that if you collect samples, and it doesn't show any Legionella, then you're not at risk, everything's fine. And if you detect any Legionella, then you know, the sky is falling and time to panic. Neither of these is an accurate situation. Again, if you're going to do sampling for Legionella, it's important to do it in the context of a water management plan and an established understanding of your building water systems. Legionella is naturally occurring. A low level of Legionella is not uncommon to find when testing building water systems, simply because it's present at a background level in your water supply. Similarly, not detecting Legionella may simply indicate that although your system is perhaps in an at-risk condition, the conditions at the time of testing were not favorable to Legionella growth, and it was being outcompeted by other microflora in the system at the time of sampling. And so properly assessing risk requires looking at multiple factors that relate to the water quality and the performance of your building water system.
There's mud, right? So, I mean, the long and the short of that, the sampling is that the presence or absence of Legionella neither indemnifies or absolves from responsibility for the water system. So that's why it's important to have that context of the entire picture. So the ASHRAE 188 checklist, this is something that we've developed as a way to sort of consolidate what ASHRAE is asking you to look at to determine whether or not your building falls underneath this regulation or whether or not you have systems at risk. So it divides it up into a property type here, the status of the building, the water systems that you may potentially have, and then some of the building risk factors. So this applies to healthcare facilities as well. If you recall from our Legionella associated illness slide, the at-risk populations are people who are immunocompromised, elderly, populations you may typically find in a hospital. So definitely a risk factor there. The purpose of this checklist is to assist building operators in determining whether their facilities they manage are subject to the risk management requirements outlined in ASHRAE 188. So it goes on. We also look at current water management programs and practices. You may already have something established at your facility, but then it looks at some of these specific components, and we can get into the details later on when we talk about establishing a management team and looking at some more practical implementation.
To quickly look at some of the treatment technologies that are out there. Some of these you've probably heard of. There's a lot of options, whether it's superheating treatment or a copper silver ionization system or a UV treatment system. Each of these treatment options can help manage risks in your building water system. They each have their pros and cons, and it's just important to make sure that before you select one or decide to use one, you're aware of the benefits and costs associated with it and are selecting something that is both cost-effective and targeted towards solving, or managing risks that are present in your particular water system.
We go from a really pretty slide to some pretty gross pictures, a detail of an ice machine there on the left. So some non-treatment controls, engineering controls are things like eliminating dead legs. That's what you see pictured up at the top on the left side there. Controlling the temperatures with the system, installing inline filtration, specifically the ice machines, replacing equipment, installation of circulation pumps, and some mist minimization.
Yeah, and I think I'll follow up with that and say also just regular routine maintenance on schedule and to keep your systems clean. That ice machine is clearly in dire need of a thorough cleaning, and just doing that will do a lot to help minimize your risks. Here's some of the non-treatment controls. So your administrative controls, plumbing exercise or flushing is a really important control. This is going to be something that you're going to want to consider implementing anytime you have low use or unused fixtures in your building. They are going to be at higher risk for colonization because as that water is stagnant, the temperature will typically come to room temperature, and whatever disinfectant may have been put into that water by your municipality, or if you have a treatment system by your system, is going to be used up and dissipate, and its effectiveness will reduce over time. The good thing is that this is typically very easy to perform by your maintenance staff or other staff who are commonly circulating throughout your building. And you know, that and regular maintenance, cleaning, disinfection, as I mentioned before, can help control scale and biofilm on more water systems.
So some temporary mitigation controls, I mentioned these earlier, the point of use filtration. There's pros and cons to both of these options here. So long-term use, they do require some maintenance. Cannot rely on them as the sole control of your water system. It does require regular change out. Utility or equipment shutoff, so potable water fountains, cooling towers, turning those off. The shutoff can create dead legs. It can create stagnant water. So eliminating the use of those points of use or those particular pieces of equipment by itself is not necessarily a good mitigation control, as it can create more issues.
Well, control measures that we've been discussing can kind of be classified into three kind of greater groups of control. So using temperature to control risks by keeping the water temperature or the system temperature outside of that favorable growth range, you're going to minimize the risk of amplification. By maintaining flow through the system, you're going to help maintain temperature and also help maintain disinfectant present in that part of your system. And then by doing cleaning and disinfection, you're going to help control the presence of biofilms, sediment, scale, and reduce the chance that you have an environment that is hospitable to Legionella or other waterborne pathogens, and control your risks that way. And generally, you're going to be looking at using combinations, pieces of all three in different parts of your water systems. There's typically not a one-size-fits-all for all water systems in a building.
All right, so if you recall from ASHRAE 188, it did talk about establishing a water management program or some type of program. And this is, there is a first step to that you can do today on your own, is to create a team that is going to be in charge of water management facilities. It should generally include senior management or an owner representative, some sort of facilities or engineering experts, environmental services, custodial representative, any other critical stakeholders that are relevant to your particular facility type, consultant, that's or David, and potentially your treatment contractor as well.
The key elements of that ASHRAE 188 standard to look at, and key things to look at in your water management plan. You want to go through that ASHRAE 188 building checklist to see if you have any specific plumbing fixtures that need to be managed, or if your building has risk factors that would require a whole building water management plan. You'll want to look at the health of your water supply, that is, what quality water is being provided by your municipal provider or from your alternative water supply. You'll want to look at the health of the system and establish control ranges. We want, temperatures, disinfectant levels, flow rates, and things like that, that you want to kind of manage and maintain your building in the chosen risk minimizing ranges. You want to look if there are any particular areas with more sensitive occupants or users where there's higher risk, and consider whether or not you need to implement additional risk management controls in those areas. Look at systems that have potential to create aerosols and expose your building occupants. And then also important is to look at any construction plans you might have. I know especially in healthcare facilities, construction is a very frequent event. And very often when we have construction, a system that is normally well maintained and in steady use will all of a sudden be shut off temporarily, resulting in the creation of a series of effective dead legs and a large section of stagnant water that may both host bacterial amplification during the construction and release bacteria back into your circulating and in-use water systems, or create a risk after construction is completed and that water system comes back online if it isn't managed during construction.
So within your water management plan, that first step is forming the team, then doing a comprehensive risk assessment of your facility and all the buildings included in your facility, and then creating the plan itself. This is a pretty involved process. So the way that we approach it is we do our site risk assessment first, collect a lot of information. Hopefully we have some plumbing diagrams. I know some facilities are older and they're maybe hand-drawn, or they're the size of an entire room and they're torn up and they're in a basement somewhere. So we create water system flow diagrams. It's critical to understand how water flows through your building. We were saying earlier about the sampling alone. You know, if you sample different points of use in your facility and you have Legionella present in those samples and you don't understand how the water moves through your facility, you can't really trace it back to a potential source. So that's the first critical step in the management plan there. Obviously the risk assessment, and then creating hazard control measures from the risk assessment, monitoring different parameters and values.
Learning different parameters and values, choosing what your what parameters and values you believe are effective for controlling risk, and then monitoring them to ensure that they don't go out of line, creating contingency plans for when different systems go outside your control limits, because they inevitably will, performing verification testing to confirm that the systems you believe you've set up are actually in place and operating as designed to control your water quality and your risk, and then doing validation testing is usually kind of the final and ongoing step to validate that the plan is actually controlling risks of waterborne pathogens in your system. This is usually where we would talk about doing Legionella sampling, is at that validation step after you believe that you have successfully established a water management plan and controlled over your system. We mentioned before, hazard control plan. This is, in our approach, typically the heart of your water management program. This is going to identify all of your points of risk. It's going to identify acceptable parameters for each system that you're managing, and it's going to identify what maintenance steps are required and what response actions should be taken if the systems go outside their planned control ranges. It's also going to identify how you're going to administer and document the program. One of the things that we think is absolutely critical in all of these programs is not just making sure that you're taking the steps to manage your risk, but also making sure that you have it documented so that if there is ever a question, or hopefully not, but if there's ever a litigation situation, if it's not written down, it didn't happen. And so documentation of all of your controls is also a critical component of the plan.
The water management, I know it seems like a lot of overwhelming information, and it is. It is a huge, huge document that you get at the end of this whole process. And what I've seen, and I think I speak to some of the other consultants, is that the implementation of that plan can be really challenging when you're dealing with an already overtaxed facility where you don't necessarily have enough manpower to even perform programs that you already have in place. So it's a process. It's not a final document in and of itself. It's something that develops over time. And I would say it takes roughly a year to 2 years to really get it in the right way. Program administration, having a dedicated team that is committed to at least the verification and following up on validation of the program is really critical.
All right, and that brings us to the end of our presentation. So we would like to hear from you. If you have questions, please let us know. We'll try to answer them.
Yeah, we've had quite a few questions submitted, so we'll try to get through as many as we can here. First question, if you were to take an OSHA class in relation to Legionella, which course would this subject possibly be covered under?
That is an excellent question. You know, I'm honestly not entirely sure if there is an OSHA course that covers Legionella. OSHA does not have a standard specific to Legionella. They do have some guidance they had a guidance published a while back that they've now considered obsolete, but they do regulate it under the general duty clause. And so when you're dealing with an OSHA complaint or concern, it's largely going to be about understanding what the concerns of your particular OSHA inspector are. As I said, they have a guidance document that was published a few years ago, but is now considered obsolete and is not typically referred to. It has very few specific standards in it, and they largely only apply to cooling towers, and they're not very stringent. So it's a starting point, and if you're dealing with OSHA, but it's not typically going to be the full answer. It's really going to be somewhat case by case. I don't know if they have a specific class. I can look into that, but I don't think I'm aware of any specific classes from OSHA.
The only one that I can think of that even briefly covers it is OSHA 521, which is the Introduction to Industrial Hygiene course. But if you're not an EHS staff person, or if that, it covers a lot of things. And I think maybe there were 1 or 2 slides about Legionella. Hopefully that answers your question.
All righty, next question. Many large older facilities, for example, hospitals that do not recirculate hot water, have trouble maintaining temperature controls due to lack of water use overnight. How have you dealt with this situation in the past? Plumbing modifications usually are not feasible in the short term, except during large renovations.
That's also a very good question. And this is really where we look at having multiple sets of controls and figuring out which of those controls are applicable to the particular situation. Temperature, as you say in the question, is very hard to control if you don't have an actively circulating system. Anytime water is sitting for more than an hour or 2, it's typically going to end up at room temperature. In that particular case, I would really be looking first at what levels of residual disinfectant you have, and making sure that you have a good flushing program in place. So when you have a room or a fixture or system that is not in use for more than a few days or a week, looking at making sure your staff is coming in and flushing that system or that fixture so that you're getting fresh water with disinfectant, and then bringing the disinfectant levels up to an effective level so that you're maintaining an environment that is inhospitable for bacterial growth. And then making sure you're doing your verification and validation testing. That's going to be something where you're going to have to kind of calibrate your response over time, right? You're going to start by implementing, say, a weekly flushing program, and then your verification testing and your validation testing is what's going to confirm whether or not that's effective, or if you need to consider alternative controls, such as long-term doing a plumbing modification and building that into your capital improvement plans, or installing a treatment system or something of that nature.
All right, and next question, please discuss pros and cons of chlorine dioxide versus copper-silver ionization programs for large complex facilities.
Oh boy, off the top of my head, let's see. So the pros of chlorine dioxide is that it's a fairly aggressive oxidant, and it has been shown to have fairly good penetration of biofilms and a decent level of effectiveness at controlling bacterial growth in water systems. I think the downsides to chlorine dioxide, again, is off the top of my head. I may have to get back to you on, double check this and get back to you on it, but I believe the downsides are that it is a fairly aggressive oxidant. It's also going to cause corrosion and additional wear on your plumbing systems, which can, lead to leaks and other failures and require more maintenance. Installing a chlorine dioxide system is going to be a permitted water treatment system that requires PA permitting as a water treatment provider, which has its own regulatory compliance burden, and is going to have various expenses associated with it. let's see, copper silver ionization systems. They actually, let's see, again, they can be effective in controlling bacterial growth. I think that there is somewhat less research on the effectiveness of the copper silver ion systems. However, what there is does suggest that they can be effective. Again, there is a substantial maintenance cost associated with the system and a permitting requirement. There is some corrosion of your systems that will result from the use of the system. And, you know, really, there's no one size fits all. It's going to depend on exactly what your building water system looks like and which method is going to be appropriate for it. If so.
All right, and we've got, it looks like we've got time for about one more question. There were several submitted, but we'll make sure to respond to those directly after the webinar if we can't get to them. So the last one that we'll cover today is, are there any studies that indicate the effectiveness of coating water supply pipes to reduce the likelihood of biofilm growth?
You know, honestly, I am not sure. I will have to get back to you on that one.
All right, let's do one more then. How long will Legionella survive?
Corrosion.
Say that one more time, Madeleine.
So it will prevent corrosion, but there's not currently any studies on Legionella growth specifically.
Okay. And then last one, how long will Legionella survive on a surface when not in biofilm?
A surface outside of a water system?
They didn't clarify.
It's, yeah, if it's a completely dry surface, I mean, very, very short. I mean, seconds or maybe minutes, that's about it if it's a completely dry surface. But Legionella is rarely found in a dry environment. So
when we talk about it being in soils, you know, we're looking at soils where there's water, where there's dampness, but it will rapidly dry up and desiccate. That's why we don't ever recommend air sampling as a good method for testing for Legionella.
Okay, great. And again, we will respond to all of the questions that were submitted today directly. David and Madeleine will respond to those. But thank you to everyone for joining us today. And thank you, David and Madeleine. That was wonderful. We'll be sending out a link to the recording of the webinar as well for your reference, as well as contact info for David and Madeleine should you have any other questions that come up that you'd like to ask them directly. And that concludes our webinar today. David and Madeleine, do you have anything else to add or?
I just want to say thank you for the, you know, we were surprised and really pleased at the level of interest, and really happy to help answer any questions. You know, the great thing about being a consultant is that we get to help people solve problems, and it's something I really enjoy as well as the.
Yes, and I also would like to echo that and just say thank you for attending. If you're interested in managing these challenges, it's great to hear that there are people who are interested in trying to protect the health of their buildings and protect the health of the people who use their buildings. Yeah, thank you very much. And yeah.
Great. Have a great afternoon, everyone.